Hello, and welcome. Today, we're diving into a neurological condition that primarily affects infants, congenital hydrocephalus. We'll explore what it is, why it happens, how it's diagnosed and treated, and what the future holds for those affected by this challenging condition. Congenital hydrocephalus, as the name suggests, is present at birth. The why behind it is complex and often multifactorial. Some cases stem from genetic mutations passed down through families or arising spontaneously. Others are caused by developmental abnormalities during pregnancy. These abnormalities can obstruct the flow of cerebrospinal fluid or CSF. Infections during pregnancy, such as toxoplasmosis, rubella, or cytomegalovirus, can also contribute. In some cases, the precise cause remains unknown. To understand hydrocephalus, we need to understand cerebrospinal fluid, or CSF. This clear fluid cushions the brain and spinal cord, removes waste products, and delivers nutrients. It's produced in the brain's ventricles and circulates through specific pathways. In hydrocephalus, this circulation is disrupted. This can be due to a blockage, like stenosis of the aqueduct of Sylvius, which connects the third and fourth ventricles, or it could be due to impaired absorption of CSF by the arachnoid villi. When CSF can't flow or be absorbed properly, it accumulates within the ventricles. This excess fluid puts pressure on the brain, compressing brain tissue and disrupting normal brain development. The exact prevalence of congenital hydrocephalus varies, but it's estimated to affect roughly 1 to 3 out of every 1,000 live births. The prevalence can differ based on geographic location, access to prenatal care, and genetic factors. More research is ongoing to understand the specific populations most at risk and to identify potential preventative measures. The signs and symptoms of congenital hydrocephalus vary in severity and can depend on the age of the infant and the degree of pressure on the brain. Often, the most visible sign is an abnormally large head size or a rapidly increasing head circumference. Other symptoms can include a bulging or tense fontanelle, which is the soft spot on a baby's head, prominent scalp veins, downward deviation of the eyes, often called the setting sun sign, irritability, poor feeding, vomiting, seizures, developmental delays, and muscle stiffness or spasticity. Diagnosing congenital hydrocephalus typically involves a combination of physical examination, measuring head circumference, and neuroimaging techniques. Ultrasound scans can be used during prenatal care to detect ventriculomegaly, an enlargement of the ventricles. After birth, cranial ultrasound computed tomography or CT scans, and magnetic resonance imaging or MRI scans are often used to visualize the ventricles and identify the cause of the obstruction or impaired absorption. Regular monitoring of head circumference is crucial in infants suspected of having hydrocephalus. Congenital hydrocephalus can be broadly classified based on the cause and location of the obstruction. Obstructive, or non-communicating, hydrocephalus occurs when there's a blockage within the ventricular system, preventing CSF from flowing freely. Communicating hydrocephalus, on the other hand, occurs when the CSF can circulate through the ventricles but is not properly absorbed. These classifications help guide treatment strategies. The primary goal of treatment for congenital hydrocephalus is to reduce the pressure on the brain. The most common treatment is surgical placement of a shunt. A shunt is a flexible tube that diverts CSF from the brain to another part of the body, usually the abdomen, where it can be absorbed. Another surgical option is endoscopic third ventriculostomy, or ETV. This procedure involves creating a small opening in the floor of the third ventricle, allowing CSF to bypass the obstruction and flow to the absorption sites. These surgical interventions are often life-saving and can significantly improve neurological outcomes. Following surgery, ongoing monitoring and management are essential to ensure the shunt is functioning properly and to address any potential complications. Currently, there's no guaranteed way to completely prevent congenital hydrocephalus. However, certain measures can reduce the risk. Ensuring pregnant women receive adequate prenatal care, including vaccinations and screening for infections like toxoplasmosis, rubella, and cytomegalovirus, is crucial. Genetic counseling may be recommended for families with a history of hydrocephalus or other neurological conditions. The prognosis for individuals with congenital hydrocephalus varies significantly depending on several factors, including the severity of the condition, the underlying cause, the timing of diagnosis and treatment, and the presence of other medical complications. Early diagnosis and prompt treatment can significantly improve outcomes. Many children with hydrocephalus go on to live fulfilling lives, although they may require ongoing medical care and support. Researchers are actively exploring new and less invasive treatment options, including advancements in shunt technology and gene therapies, to improve outcomes and reduce the long-term burden of this condition. By understanding the causes, symptoms, and treatment options for congenital hydrocephalus, we can work towards better outcomes for all those affected.